And to speak about these issues, we're joined now by Dr. Mvuyisi Mzukwa. He is the National Vice Chairman of the South African Medical Association, or SAMA. He joins us now. Very good evening to you, and thank you so much for speaking to us. So we'll talk about why Sputnik is not authorized for use in South Africa. But I want to talk about the team that is here joining the South African scientists. So we have the Health Ministry, Consumer and Health Welfare Watchdog as part of that team. What is the strategic importance of having them as part of the team?
Well, thank you so much, SABC, for having us in your program. We have sketchy information around the arrival of these specialists in the country. We understand that this is an arrangement that has come between the presidents, Ramaphosa and President Putin. And we, at the moment, have no idea what is the issue around there. But we understand that these are people who are not going to be working in the facilities. They are going to be joining scientists in the country and also, assist with the genome surveillance on COVID-19 and other related work. So there is nothing much that we have other than the information that I'm giving you now.
And why do you think that information is so scant, especially for an important body such as SAMA? South Africa and its scientists have been hailed as being very instrumental in identifying not only the new variants, but the mutations and various other scientific developments. So I'm just trying to understand, and this is not, of course, to question the contribution that will be made by scientists from the BRICS centers, but what are they bringing here that we could learn from them?
Well, I do think that, it's a question of, collaboration. If honestly, that's what I learned from this. Obviously, you know that the northern part of the globe has reacted negatively when we had the Omicron variant. So it would be obviously strategic to obviously work with the BRICS, to understand the challenges that we have within the country. But also that, like you said, we don't feel that our scientists are really needing support, but I do think that they can work together. They can learn from each other. I am sure that they're here to learn as well, as to how to deal with this variant and other issues, related to this pandemic. But obviously, as you have said, we don't think that we are short of expertise in the country.
You mentioned a very important thing, the reaction of the North in South Africa's announcements of identifying the Omicron variant of interest at the time. And we're talking about collaboration here, where we're going to have a BRICS Vaccine Research and Development Center. Ultimately, this is what I understand President Cyril Ramaphosa has had the discussions with President Putin about and realizing. Do you think something like that would then make people a little bit more hesitant in taking such drastic action on hearing the news of a discovery where there is scant information to take strong action?
Yeah, I think, what has happened to South Africa really is very unfortunate. Because, we thought that as a country we are being transparent, but also we're obviously displaying our scientific prowess. But what we have noted is that it has not been taken in a good light, and, it has many implications. Even in other countries, you'll find that there will be no such transparency that we will see in the future with other countries. Maybe even the South Africa will need to rethink on how to disclose such information to the world, whether to directly go to the World Health Organization and just disclose the new variant instead of making pronouncements publicly. I think, we've learned our lesson from this. So I do think we do honestly need to learn from what has happened. It has implications with other countries, I can assure you.
It's intriguing that you should say that, because observers have been, in some cases, critical of our communication strategy. And I'd like to flip this on its side and say perhaps we at home have not done enough in bringing to light, particularly the scientific breakthrough announcements and developments here. And I'm going to talk about Sandile Qele, for instance, as a biologist, and the work that he has done, and that is with regards to the Beta and Omicron. I believe that he was instrumental in developing a live virus of COVID-19's Beta variant to assist in the virus evolution. Do you think that we should be doing more to bring to light, not only to South Africans, but to the world, the kind of scientific research and development we're doing?
It is very important for the world to know that we've got enough expertise in the country, and also it will also assist with the confidence, that the world must have, when they watch, our scientific developments. It is important also to note that it's not only on COVID-19. There are many other areas where you find that scientists in the country, are of the world standard. So I do think that we need to do more in terms of showcasing, our prowess in terms of our scientific development. That will assist, attract partners, in some of the projects that are very critical, to deal with the challenges that we have within our borders.
Mm-hmm. I want to go back then to SAPRA's decision not to approve Sputnik for use with regards to vaccine intervention for COVID-19 in South Africa. So the concerns were around the fact that the vaccine may increase the risk of HIV infection among vaccinated males, because that the vaccine uses two adenoviruses in its manufacturer, type 26 and type 5. Tell us about this and the importance of this, especially if we are saying we have Russian scientists here in South Africa to help us glean more on the development of the vaccine or the evolution of the virus.
I think that the important thing that we are observing with SAPRA is to try by all means to display science that is independent of politics, which is very important when we deal with such pandemics. So I think that's what they wanted to show first. But secondly, that there's a trusted scientist, world prominent in the world, that they take decisions objectively, and they follow science. I do think that we need to trust what comes out of SAPRA, because they are really working on their mandate. They are delivering what is expected of them in terms of the legislation. So I do think that if we have any questions, other scientists may ask questions that the public might might not know, but we do need to trust the information that comes out of SAPRA. I don't think that they have any political interest in whatever happens with that vaccine.
As you say, because the makers of the Sputnik vaccine have apparently denied this, and yet we're going to be collaborating. So there has to be an agreement on common cause facts here, I'd imagine, that this is what we've developed, this is what we can help you glean from the work that we've done as scientists from Russia or any of the BRICS countries. So, or am I naive in thinking that the collaboration of these scientists would have to ask some tough questions? There has to be a questions or agreement to some troubling facts.
Yes, I believe so, Tsepi, that there will be that interaction. between our scientists and scientists that are coming from Russia, especially as it relates to what you have raised now, because we do understand that they might have issues with the denial of this vaccine in the country, or approval by SABC. So I do think that it might give them an opportunity to have an interaction and understanding what are the issues that are being raised by our scientists. But I do applaud our scientists, for being objective and independent of the political environment that we are living in, so that we don't find ourselves dealing with side effects of many of these issues that have been seen by our scientists when they dealt with the approvals.
And as you say, that health and well-being should be outside of those politics. Thank you so much for speaking to us. Dr. Mvuyisi Mzukwa is the National Vice Chairman of the South African Medical Association, that is SAMA. When we return, we'll be looking at medical interns who are on strike in Uganda. What is the impact of this on medical services in the country, this as the government tells them to vacate the hospitals that they've been working in to make way for another group of interns who possibly won't have the same demands. This is The Globe. Do stay with us.